All right, so let's dive into this news about this new Mpox strain in the U.S. You might remember all the stuff about the 2022 outbreak, but this is different, right? Different strain, and it seems like it might even be spreading in a new way.
Yeah, you're right. It's definitely something to keep an eye on. In 2022, it was mostly men who have sex with men who are getting infected. But this time, it's spreading through other types of close contact, too, especially kids and other vulnerable groups, mostly in Africa, where this new strain seems to have come from.
So this isn't just a repeat of what we saw before then. This new strain, what is called
Yeah.
Clade I, that's something we need to be taking seriously.
Yeah, Clade I has actually been spreading in Eastern and Central Africa for a while now,
Yeah.
and it does seem to be more severe than the strain we were dealing with back in 2022.
More severe, what does that even mean? Like, what's different about it?
Well, it looks like it can lead to more complications, even if you get proper medical care. And the World Health Organization is saying that there have already been over 3,100 confirmed cases since the end of September, mostly in Burundi, Uganda, and the Democratic Republic of Congo.
Wow, over 3,000 cases. That's a lot. So how did this new strain even get to the U.S.?
Well, the first case in the U.S. was reported by ABC News, and it seems like it was someone who had traveled to Eastern Africa, and then they started sharing symptoms after they got back to the U.S.
So this new strain doesn't care about borders then? What's it even like in Africa right now? Are they able to contain it at all?
Well, the Africa CDC has actually asked for 3 million Mpox vaccines just for the Democratic Republic of Congo, so I think they're definitely facing a tough situation over there.
3 million vaccines just for one country. That sounds pretty urgent. But you said that Clade AI is more severe. What does that mean exactly? What makes it so different from the strain we saw in 2022?
Well, this is where it gets interesting. It seems like Clade has some genetic differences that make it more likely to cause really serious illness. It can cause bigger lesions. And there's a higher risk of complications like pneumonia and encephalitis.
Pneumonia and encephalitis. Those are some serious complications. So even with good healthcare, this new strain could be a lot more dangerous.
Yeah, and that's why it's so important to understand how it's spreading. While sexual contact is still a big factor, we're also seeing transmission through close contact with children and vulnerable groups. It's not just limited to one community anymore.
Okay, so this is definitely something to pay attention to. But before we go any further, I just want to make sure we're all on the same page about what a clade is. It sounds kind of technical.
Well, it's actually pretty simple. Think of a clade like a branch on a family tree. Each branch is like a group of viruses that share a common ancestor, and they have similar characteristics. So Clade I is like a specific branch of the Mpox family. It's separate from the strain we saw in 2022.
Okay, that makes sense. So this case in the U.S., is that from the same clade I that's spreading in Africa? Or is there even more to it?
It seems like this case is actually linked to a subclade of Clade I called Clade I. It's like a smaller twig on that Clade I branch, and Clade I has been showing up in travelers in other countries too.
Clade I. So there are even more variations within this new strain. What's the deal with this Clade I then? How does it compare to the other Clade I strains?
Well, we're still figuring out all the details about Clade I, but it seems to be particularly good at spreading. It might be more transmissible, or it might have a longer incubation period, which would mean it could spread more easily before people even start showing symptoms.
So this Clade I is even more sneaky than the other Clade I strains. That's a little concerning.
Yeah, it's definitely something to watch out for. But there is some good news. Even though it's concerning, Clade I hasn't been as deadly as some of the previous Clade I outbreaks.
So it spreads more easily, but it might not be as deadly. Is that because we have better healthcare now? Or is there something else going on?
It's probably a bunch of factors, including access to healthcare. But we need more data to really understand the differences in severity.
Yeah, it's still early.
Mm-hmm.
And we're still learning about this new strain and what kind of impact it could have. Is there anything happening globally that we should know about? Like in terms of tracking it and containing it?
Oh, yeah. The World Health Organization is definitely keeping a close eye on everything. They've scheduled a meeting for November 22nd to reassess the global risk level of this strain.
November 22nd. Okay, we'll have to mark that on the calendar. We'll be watching for any updates from the WHO. But in the meantime, should people in the U.S. be worried?
I mean, it's normal to be concerned, but for the general public in the U.S., the risk is still pretty low. The case in California seems to be isolated for now. But it does remind us that infectious diseases don't really care about borders. And what happens in one part of the world can quickly affect other parts.
So we're not panicking yet. But we're definitely staying informed and being careful. This new Mpox strain is something we need to pay attention to. But let's not jump to any conclusions. We'll dig deeper into the global response. the lessons we learned from 2022, and what all this means for us in the next part of our deep dive.
You know, it's kind of crazy how this new strain is showing up while we're still dealing with the long-term effects of COVID-19. Really shows you how connected all these global health challenges are. We can't just treat them separately.
Yeah, it feels like we're constantly getting hit with new health threats. It's kind of overwhelming to keep up with it all. This Clade I, with its potential for increased transmission. That's a perfect example. It makes you wonder what we actually learned from the 2022 outbreak, and are we using those lessons now?
That's the million-dollar question. The 2022 outbreak definitely showed us some gaps in our public health systems. But it also gave us some valuable insights. We saw how quickly vaccines could be developed, which really helped contain the spread. And we've made progress since then. The CDC is keeping a close eye on things, issuing travel advisories, and working with health departments to improve surveillance.
So there's been some movement, but is it enough? This new strain seems to be spreading differently, affecting more vulnerable groups. What more needs to be done, especially on a global scale?
You're right, things are different this time. We need a multi-pronged approach. The WHO is playing a big role in coordinating global response efforts. They're providing guidance, facilitating information sharing, and mobilizing resources. Their meeting on November 22nd is going to be really important in assessing the global risk level.
It sounds like the WHO is kind of like a global command center, bringing everyone together to deal with this new threat. But what about individual responsibility? Besides the basics like washing our hands, what can we do to protect ourselves and stay informed?
Being personally aware is key. Stay up to date with information from reliable sources like the CDC and WHO. And be careful about what you see on social media. Stick to verified sources to avoid misinformation and unnecessary anxiety.
So no doom scrolling through questionable posts. Got it. Stick to the facts from reliable sources. Makes sense. But even with all this information, it's still unsettling to think about a new, potentially more severe strain out there. What does it say about our global health preparedness overall?
It's a wake-up call. It reminds us that infectious diseases are a constant threat, and we need to be proactive. We can't just react to outbreaks when they happen. We need to build a stronger, more resilient global health system, one that can anticipate and mitigate these threats.
It's like we're in a never-ending race against these evolving pathogens. We learn, we adapt, we improve, but there's always the potential for something new and unexpected. How do we even begin to prepare for the unknown?
It's about building a more comprehensive and adaptable global health security system. That means investing in research, surveillance, and preparedness measures. That can address a whole range of potential threats, not just the ones we're seeing right now. We need to move beyond reacting to things and become more proactive.
So it's not just about tackling one disease at a time, but about strengthening our overall health infrastructure to handle anything that comes our way. It's like building a strong immune system, not just for individuals, but for society as a whole.
I like that analogy. And just like a healthy immune system relies on a complex network of cells and processes, a resilient global health system requires a coordinated effort from governments, organizations, communities, and individuals. We all have a role to play.
So it's a team effort, and every action counts. What are some concrete steps individuals can take to contribute to this collective effort?
Staying informed is a great start. Share accurate information with the people you know, and support organizations that are working to improve global health. There are so many NGOs and initiatives doing amazing work to strengthen health systems, promote access to healthcare, and develop new treatments and vaccines.
Those are great points. Even small actions can make a difference when we all work together. But sometimes these global health issues feel so huge and complex. How can we as individuals really make an impact?
Think back to the 2022 Mpox outbreak. The global response showed us what we can do when we work together. The quick development of vaccines and the effort to contain the spread, those were inspiring examples of collective action. We can use that same energy and determination to address this new challenge.
That's encouraging. It shows that we're not powerless against these threats. We can make a difference. But with all the focus on Mpox, are there other potential threats we should be aware of? It seems like there's always something new on the horizon.
Oh, absolutely. Mpox is in the spotlight right now, but it's not the only infectious disease out there. There are countless other pathogens, some we know about, some we haven't even discovered yet. Whole ecosystem of potential health threats, constantly evolving and interacting with each other. And we're always trying to stay one step ahead.
That's a great analogy. So how do we even begin to prepare for this complex web of potential threats, especially the ones we don't even know about yet?
That's where a proactive approach is even more important. We need to invest in research, surveillance, and preparedness measures that are broad and adaptable. That includes strengthening laboratory capacity, improving disease surveillance networks, fostering collaboration between researchers and policymakers, and investing in the development of new vaccines and treatments. It's a multifaceted strategy, but it's essential to build a health security system that can handle a wide range of threats, both known and unknown.
It's a big challenge. But we can't afford to ignore it. Our health and well-being depend on a robust and resilient global health system, one that can effectively address these emerging threats.
Yeah, it really puts things into perspective. It's not just about Mpox. It's about realizing there's this whole web of connected health issues we need to be ready for. We were just talking about how this new strain is coming up while we're dealing with things like the long-term effects of COVID, antimicrobial resistance, vaccine hesitancy, and health inequities.
Exactly. It shows how much we need a holistic approach to global health security. We can't just look at diseases one by one. We need a system that can handle anything.
So we're talking about building a solid foundation then, a really strong global health infrastructure that can support all these different areas.
That's it. If we zoom out and look at the bigger picture, it's about investing in strong surveillance networks, public health education, accessible healthcare, and international collaboration. We need a system that can adapt and respond well to all kinds of threats, the ones we know about and the ones we don't. That makes sense, like
Yeah.
building a strong immune system, not just for a person, but for society as a whole. But it seems like such a huge task. Where do we even start? What can regular people do to help?
It can feel overwhelming for sure. But remember, every little bit helps. Staying informed is crucial. Keep up with reliable sources like the CDC and the WHO. And share accurate information with people you know. You'd be surprised how much of an impact that can have on fighting misinformation.
So we can all be like health information ambassadors. What else?
Supporting organizations working to improve global health is another big way to contribute. There are tons of NGOs and initiatives doing really great work. Strengthening health systems, promoting access to healthcare, developing new treatments and vaccines. Even small donations or volunteering your time can make a real difference.
It reminds you that we're not helpless. We can all do something to build a better future. The 2022 Mpox outbreak showed us what's possible when we work together, how quickly they develop vaccines, and the global effort to contain it. Those are great examples of what we can do when we work together. We need that same spirit of working together and coming up with new ideas to handle these new challenges.
Absolutely. It's not just about science either. It's about people making smart choices, speaking up for better health policies, and supporting organizations that are making a real difference.
It's about combining scientific progress with social change. We need both to make a global health system that can really handle anything.
This deep dive has been really interesting, and I hope it's given our listeners a lot to think about. But before we finish up, is there anything else you want to leave them with? I think the biggest thing to remember is this. This new Mpox strain is something to be concerned about. But it's not a reason to panic. We have the knowledge, the tools, and the resources to deal with it. But we need to act together and act decisively. We need to learn from what's happened before, stay informed, and work together to create a healthier and more secure future for everyone.
Well said. This new Mpox strain is a test, not just of our science, but of our willingness to learn from the past and build a stronger future. To our listeners, I'll leave you with this. What will you do to make sure we're ready for the next health challenge, whatever it might be? Thanks for joining us on this deep dive. Stay curious, stay informed, and stay engaged.